28 states across Nigeria have reported cases of lassa fever outbreak that has led to mortality and morbidity. Dry season is usually the period of heightened vulnerability of the spread of the disease. It is for this reason that the National Orientation Agency has stepped up efforts to mobilize Nigerians on the need to take proactive measures against the disease. Addressing newsmen on the nationwide preventive campaign, the Director General, Lanre Isa Onelu, said the reoccurring outbreak underscores the importance of collective action in preventing the spread of lassa fever. Represented by the State Director, Mrs. Teresa Omaga, the DG noted that the objective of the campaign in 7 states is to educate Nigerians on the risks, prevention and control measures to combat the spread of the disease. He emphasized on preventive measures.
We urge all Nigerians to take note of the following. 1. Lassa fever is preventable. 2. Maintain good hygiene practices, including regular hand washing with soap and water. 3. Store food in rodent-proof containers. 4. Avoid contact with infected persons or contaminated materials. 5. Report suspected cases to the nearest health facility promptly.
The agency is to use its structures and platforms at the local government level to engage community, traditional and religious leaders to mobilize grassroots support, and will collaborate with schools to integrate lassa fever and other infectious diseases prevention into their teaching engagement. Deputy Director Health and Social Care of the National Orientation Agency, Simon Odugu, noted that the campaign is focusing on 7 states for now.
Cumulatively, from January to we're in November now, as at last week of October, cumulatively, that's throughout the nation, we have 175 deaths. 100, that's recorded, the one that is reported. Figures from the NCDC, because they are the custodians of the figures. You understand? And over 1,000 suspected cases. 128 local governments in the country are affected in terms of suspected cases. Then also in terms of the number of spread, it's across 28 states of the Federation. So it's something that happens and has to do with our attitude mostly.
Similarly, the State Office of the National Orientation Agency held a stakeholder sensitization meeting to mobilize support for the campaign. The nationwide preventive campaign on lassa fever outbreak, in collaboration with the Federal Ministry of Health and the Nigerian Center for Disease Control.
So this kind of gathering is important for us because the agency will now educate the public on how to prevent disease, so that our work will be less.
This occasion is quite timely, looking at the seasonal occurrence of this disease, and it's good to be prepared for it, educating to us, and from our side we are going to disseminate what we have had.
Lassa fever is a fatal and infectious disease that occurs throughout the year in Nigeria. Its symptoms include fever, sore throat, back pain, chest pain, and vomiting. Others include stomach pain, swelling of the face, bleeding from body openings, and restlessness. The disease is preventable and treatable. Elizabeth K, BATV News.